Yeah, good day everyone. Today I would like to talk about when a cesarean section is necessary. What do you mean by cesarean section? It's just a medical way of assisting the woman or a surgical intervention of assisting the mother to bring out the baby. There could be so many indications and there could be so many reasons for a cesarean section to be done. A cesarean section can come as an emergency or it can come as a planned cesarean section. There could be so many reasons for a planned cesarean section. Planned means something that it's just like an agreement between the patient and the doctor. They will have planned for it before they actually go in for the surgery. Some indications or some reasons for a planned or an elective cesarean section are: one, fetal macrosomia. It means maybe when the baby is so big, a big baby, the obstetrician gynecologist might plan a woman for an elective cesarean section. One, the location of the placenta also matters. If the placenta is located, we call something low-lying placenta or placenta previa. When the placenta is covering the os of the exit where the baby is supposed to pass, they can plan an elective surgery. Then the positioning or the line of the baby. A baby that is coming with feet or the foot or coming with the buttocks, an obstetrician gynecologist can plan an elective cesarean section for the baby. Then if the baby is lying in transverse position, lying horizontally, there can be a necessity for a planned cesarean section. Fibroids or some abnormality in the uterus itself, there can be a necessity to plan for an elective cesarean section. Then the history, the maternal history, the history of the mother. For instance, if the mother has an underlying medical condition like a diabetic patient, a patient that has diabetes, they can plan for an elective cesarean section. A patient that has an active infection, very active infection, especially HIV infection, herpes simplex infection, genital warts, and all those infections that can affect the baby while passing through the birth canal, an elective cesarean section can be planned for. If a woman has a multiple pregnancy means more than one baby. If a pregnant woman has more than one baby within her uterus, maybe triplets, quadruplets, twins, and the likes, an elective CS can be planned. Then we talk about emergency CS. There are some necessity, there are some conditions that you just have to go and do an emergency CS. Those are, we have the absolute indication for a CS. Those are the emergency CS. One, when we talk about fetal distress, when the baby is so distressed, when the oxygen concentration and blood supply to the